design the future. Share the wisdom to the spirit of Islam. Revelation and reason shall prevail. Merging faith and knowledge, we, the Khalifa, we will fulfill the Amanah. Together we make the world a better place. Forever expand the culture of Ikram. Is to realize the meaning of Ramadan al-Alamin. Together we make the world a better place. Forever expand the culture of Ikram. Is to realize the meaning of mercy to all worlds, for
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh kepada semua pelajar semester akhir di CFS, mungkin daripada MEDC. Jadi saya daripada pelajar tahun 3 kampus UiAM Content, ingin berkongsi sedikit pengalaman dan juga mungkin tips lah untuk menghadapi peperiksaan dan mungkin sedikit motivasi. Okey, yang pertama, untuk menghadapi peperiksaan akhir ni, tips yang paling penting ialah time management kita kena tip-top lah. Kalau kita ada study week, gunakan betul-betul study week itu untuk kita bahagikan macam mana kita nak cover semua topik yang telah kita belajar. Jadi contoh untuk siapa yang nak score macam Dean List ke, pastikan topik jangan pilih-pilih. Study semua topik, jangan kita abaikan satu topik pun. Sebab kita tak tahu topik mana yang akan ditanya. And kalau kita study semua topik, itu lebih selamat lah. Jadi yang kedua, bahagikan masa kita. Contoh kita ada pagi, kita ada siang dan juga malam. Contoh sehari kita boleh study 3 subjek. Contoh pagi boleh study subjek yang memerlukan kita untuk mengingat. Sebab pagi ni kita fresh lagi. Contohnya biologi. Tengah hari mungkin boleh buat subjek kira-kira sebab kita mengantuk. Tapi kalau kira-kira ni tak mengantuk, so kita boleh buat macam matematik ataupun fizik waktu tengah hari. Malam pun kita boleh utamakan subjek yang membaca sebab waktu tu mungkin lebih masuk lah. Di atas orang juga, depends on masing-masing macam mana. Okey, yang kedua, banyakkan bertanya. Jangan malu untuk bertanya. Apa-apa yang kita tak faham, tanya kawan-kawan ataupun tanya lecturer kita. Okey, seterusnya, ingat, selagi kita tak masuk dewan peperiksaan, selagi tu kita ada masa. Jangan kita putus asa awal. Contoh, subjek tu susah, cakap, tak ada chance lah subjek ni. Jangan macam tu lah. Selagi kita tak melangkah masuk ke dalam dewan peperiksaan, selagi tu kita ada masa untuk kita fahamkan, untuk kita buat ulang kaji. Yang penting jaga masa elok-elok. Yang terakhir, kita sebagai seorang Muslim tak boleh lari. Kita usaha macam mana pun, kita kena banyakkan berdoa dan memohon pertolongan daripada Allah Subhanahu Wa Taala. Dan yang last sekali, kita kena tawakal. InsyaAllah kita punya keputusan tidak mengkhianati usaha kita. Yang penting kita usaha, keputusan itu kita serahkan kepada Allah Subhanahu Wa Taala. Jadi itu sedikit sebanyak perkongsian dan juga mungkin sedikit motivasi. Harap dapat membantu. Sekian saja. Assalamualaikum warahmatullahi wabarakatuh dan good luck kepada semua. Bye.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Hakim bin Yusli. I'm a second year medical student in IIM Kuantan. I would like to wish the best of luck to my brothers and sisters in CFS for the final SEM examination. Don't forget to study and also make your dua. InsyaAllah you will do your best and you will score the exam. And I can't wait to meet all of you in the upcoming years in IIM Kuantan. So that's all from me. Assalamualaikum warahmatullahi wabarakatuh.
Okay, Assalamualaikum. Hi everyone, to all our junior CFS students. Okay, we are third year students and we are here to give you a little tips about how to make you go through your final exams smoothly. Okay, so firstly for your subjects, especially for physics, chemistry, math, statistics and whatnot, actually you just have to do all the tutorials that your lecturers give you. Legit, they will help you like a lot. Even somehow the questions are a bit same the tutorial and the exam questions. Yeah. And for something like biology, you just have to read a lot and and try to say it back. Like try to communicate with your friend and try to make them understand, and also you will understand it yourself too.
Yeah.
Okay.
And for the preparation yourself for the examination, please take care of yourself, sleep well, eat well, and most important, don't forget to take your breakfast before taking the exam on the day, because breakfast is the most important meal. After the exam, set your target, what you want to achieve. Don't be stressed, just try your best.
Assalamualaikum. Hi everyone. How things going for you guys? I hope you guys are doing well. I just want you guys to know that you are almost there in reaching your success. This is your final semester. Just make sure that you spend your 24 hours wisely, because everyone have the same amount. I also have 24 hours, not more and less. But what makes your 24 hours different from others is regarding how you spend on it. So have a good mindset on your goal. Be consistent with your effort. And lastly, good luck with your quizzes, exams, especially finals. May Allah grant us success in this world and also in the hereafter. Amin. Good luck everyone.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh kepada semua junior di CFS. Saya tahun 3 di UAE Kuantan campus, dan sedikit motivasi untuk semula ataupun sedikit tips lah. Saya ni sebagai yang kata average student, nak memberi sedikit tips, which is yang pertama adalah first and foremost, bersyukurlah dengan pointer yang sekarang tu. Even tu mungkin ada yang atas pagar, mungkin ada yang di list, alhamdulillah. Kalau tapi atas pagar tu bersyukur je dengan pointer yang ada. Itu pun maksudnya petanda untuk kita, sama ada kita untuk kita terus berusaha keras sikit, dan ataupun ada hikmah dia lah. Secondly, yang kedua adalah masa-masa exam ni, dia better kita mengamalkan gaya hidup sihat lah. Petang-petang tu kalau stres kan, berjalan, berjogging apa semua. Jangan duduk bilik lah. Study stres macam mana pun, petang tu make sure kita luang masa pergi jogging, pergi jalan-jalan. Pusing juga gambang tu lah, kan best kan. Pagi pun best juga. Yang ketiga, tidur tu kena jaga. Kalau boleh masa exam tu, macam kalau boleh tidur tu awal lah. Tidur awal, bangun awal, study and then prepare untuk pergi.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Nabila Huda, iaitu student from Kuliah Dentistry. I know you now struggling in the lesson, right? So, I just want to wish the best of luck. Keep going and striving until the end. Jangan putus asa tengah-tengah jalan. I know sometimes you feel very tired and want to give up. Tak apa, chill, jangan stress tak membantu pun. Jadi chill, 5 minit, 3 minit, masa balik-balik, tingkatkan semangat balik. Minta doa kepada Allah dimudahkan segala urusan. Jangan tinggal solat, jangan tinggal Quran. Minta restu daripada ibu bapa. InsyaAllah segalanya akan dipermudahkan. May Allah bless your efforts and give you the best result. So that's all, fighting.
Hi, Assalamualaikum to all my Red brothers and sisters in CFS. I heard you guys have an upcoming final exam, and I just want to say good luck on that. I know this would be the most stressing time for you, but I believe you have done so much to prepare for this exam. And as much as I believe in you, you would have to believe in yourself that you will do well in this exam, okay? And just few reminder for me, don't forget to have enough sleeping time, good rest, especially when it's coming very near to the exam, so that you don't stress yourself too much. And a friendly reminder as well, don't forget to pray that Allah will ease the journey for you throughout this exam and throughout your student life. And last word, I just want to say good luck, do your best, and fighting everyone.
Assalamualaikum. Hi, my name is Nurul Christina, final year pharmacy students. I would like to wish all of you, all of the MEXI members, all the best in your upcoming exam. And don't forget to be healthy and drink a lot of water and don't be stressed. So that's all from me. All the best.
Assalamualaikum kepada semua adik-adik. Selamat berjaya dalam mengambil peperiksaan. Ingat, peperiksaan bukan segala-galanya, tetapi segala-galanya bermula dengan peperiksaan. So, good luck, do your best in the examination, and insyaAllah kita bertemu di kuliah nanti.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Nama saya Akmal Syam, pelajar perubatan tahun 4. So, saya nak ucapkan selamat berjaya buat adik-adik yang akan memiliki peperiksaan tak lama lagi, semester akhir. Dan sedikit pesanan, di saat-saat akhir ini paling kurang kita dah go through setiap page modul ataupun lecture kita. Paling kurang setiap page tu, kalau kita dah go through, dia dah fahamkan. Dan kalau boleh, upkan bacaan sebanyak 3 kali untuk setiap modul yang kita ada. Okay? Semoga selamat segalanya, semoga berjaya hendaknya, dan semoga kita berjumpa di kuliah nanti, insyaAllah. Assalamualaikum warahmatullahi wabarakatuh.
Let's lead the way, light in the future, share the wisdom to the spirit of Islam. Revelation and reason shall excel, shall prevail. Merging faith and knowledge, we, the Khalifa, we will fulfill the amanah. Together we make the world a better place. Forever expand the culture of Iqra. Is to realize the meaning of Ramadan al-Arabi. Together we make the world a better place. Forever expand the culture of Iqra. Is to realize the meaning of mercy to all worlds, for
Dear brothers and sisters, we will begin our event shortly. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Honorable Speaker, Mr. Muhammad Nazrin Shafiq bin Khairi, Head Department of Biology, Madam Kamaril Azlah Teruk, Mr. Aziril Iskandar bin Abdullah, Coordinator Academic Coaching and Enhancement Unit, Academic Advisor, Department of Biology, Madam Nur Saadah Muhammad Nasaha, lecturers from the Department of Biology, and dear fellow friends. Welcome to Alumni Inspire, One Step Closer sharing session. I am Nurul Huda binti Zulkifli, will be your MC for today. Praise be to Allah Subhanahu wa Ta'ala, the Lord, the Creator, and the Sustainer of the universe, as we gather here this morning to listen on beneficial inputs from our sharing session today. Dear brothers and sisters, for your information, this event is organized by the Department of Biology in collaboration with Academic Coaching and Enhancement Unit. This event is aimed to, first, boost enthusiasm for medical, dentistry, and pharmacy students in their relevant career pathway by the sharing experiences. Second, inspire all students to keep energized and motivated in achieving excellence. Third, instill positive vibes among students for achieving instant sejahtera. And lastly, revive the students' passion to further their studies. Before we proceed further, let us bless this event with the dua and Al-Quran recitation by Brother Ikhwan Hakimi. Please welcome Brother Ikhwan Hakimi.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وصحبه أجمعين اللهم اجعل جمعنا هذا جمعا مباركا مرحوما وتفرقنا من بعده تفرقا معصوما ولا تجعل اللهم فينا ولا معنا شقيا ولا محروما ربنا عليك توكلنا وإليك أنبنا وإليك المصير اللهم طول أعمارنا وصحح أجسادنا وثبت إيماننا ووسع أرزاقنا وحسن أخلاقنا ونور قلوبنا برحمتك يا أرحم الراحمين اللهم اجعلنا من أهل الخير وجعلنا من أهل البركة وجعلنا من أهل المغفرة اللهم اجعلنا من أهل الجنة وجعلنا من أهل الفردوس الأعلى برحمتك يا أرحم الراحمين اللهم اجعل مجلسنا هذا مجلسا مباركا لأصحابنا وأهلنا وجيراننا وضيوفنا برحمتك يا أرحم الراحمين ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على سيدنا محمد وعلى آله وصحبه وبارك وسلم والحمد لله رب العالمين أعوذ بالله من الشيطان الرجيم سورة العلق بسم الله الرحمن الرحيم اقرأ باسم ربك الذي خلق خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم كلا إن الإنسان ليطغى أن رآه استغنى إن إلى ربك الرجعى أرأيت الذي ينهى عبدا إذا صلى أرأيت إن كان على الهدى أو أمر بالتقوى أرأيت إن كذب وتولى ألم يعلموا بأن الله يرى كلا لئن لم ينته لنسفعا بالناصية ناصية كاذبة خاطئة فليدع ناديه سندع الزبانية كلا لا تطعه واسجد واقترب صدق الله العظيم.
Thank you, Brother Ikhwan Hakimi, for the wonderful recitation. Dear brothers and sisters, next, let us listen to welcoming speech by Madam Kamaril Azlah, Head of Biology Department.
Alhamdulillah Rabbil Alamin wassalatu wassalamu ala ashrafil anbiya wal mursalin nabiyina wa habibina Muhammadin wa ala alihi wa sahbihi ajma'in wa man tabi'ahum bi ihsani ila yaumiddin amma ba'd. The respected for today speaker, Brother Ahmad Shiham, Brother Muhammad Akmal and Brother Nazrin Shafiq, the dedicated Program Director, Madam Nur Saadah, the hardworking Committee Lines Arm, the staff of Department of Biology, and the beloved students, brothers and sisters. Alhamdulillah, with the will of Allah, we are able to gather virtually for this sharing session, which organized by Department of Biology in collaboration with Academic Enhancement Unit, ACU. For everyone information, the 3 critical courses, Medic, Dentistry, Pharmacy, is under supervision of Department of Biology. As to inspire the student of these critical courses to have strong passion to achieve excellence, this program regularly organized. Brothers and sisters, you are now in semester 3 in CFS. In a few months, you'll be graduated from CFS and will continue your studies in the course that you are all dream of. In order to ensure that you keep energized and motivated in achieving excellence, it is important that everyone here inspired by the experience of our speakers. As referred to Malay proverb, bumi mana tak ditimpa hujan, laut mana yang tidak bergelora, you will facing many challenges along the way to complete your studies. With those challenges, and in the blessed months of Ramadan, take the challenges positively, which can make you grow up, stand firm to survive in this real world. It is hoped that this program can initiate a positive vibe among you to have a character of insan sejahtera. Lastly, I would like to congratulate all of you for having flying colors of achievement in your semester 2 examination. And not to forget, I would like to congratulate the organizing committee for making this beneficial program become reality. Shukran jazila. Assalamualaikum warahmatullahi ta'ala wabarakatuh.
Thank you, Madam Kamaril Azlah, for the insightful speech. Important points that we can summarize from this speech are: students should take all challenges positively and should be motivated at all times to achieve excellence. Dear brothers and sisters, we are now reaching to the highlight of today's event. Before I pass the screen to our invited speaker, let me introduce some background of our speakers. Our speaker today is Mr. Muhammad Nazrin Shafiq bin Khairi. Mr. Nazrin started his career at Pharmacy Mira in 2017 as assistant pharmacy. In 2018, he worked as pharmacist at Pharmacy Damai Kuantan, and currently he is a director of SD Alliance Sendian Berhad. Mr. Nazrin received his degree in Bachelor of Pharmacy from International Islamic University Malaysia in 2016, and in 2019, he obtained his degree in Master of Pharmaceutical Sciences, also from International Islamic University Malaysia. Without further ado, please welcome Brother Nazrin Shafiq to deliver his talk.
Assalamualaikum warahmatullahi wabarakatuh. Everyone can hear me?
Yes.
Okay, all right. Thank you, Sister Master of Ceremony, to Madam Kamaril Azla, Head of Department of Biology, the organizing committees, lecturers, brothers and sisters, students, and my future colleagues. Assalamualaikum warahmatullahi wabarakatuh. Okay, just before we start, can I know if there is any international student?
Yes, there are some
Oh,
of them.
oh yeah. So I have to speak in English full lah kan? Okay, all right. I'll just share my slides so that we can proceed with the session. Okay. Okay, Bismillahirrahmanirrahim. Okay, all right. I believe this is my third time in a row. For the third year, I've been invited to be a speaker to talk about the pharmacy career for our fellow students from foundation going into degree in IIM Kuantan, insyaAllah. So this Alumni Inspire, I am an alumnus of IIUM. So today I'll be sharing some of experience and some heads up what you will be facing in degree life. Okay, a little bit introduction about myself. So as being introduced by Sister Master of Ceremony, I'm currently the Chief Operating Officer, come the Director of SD Alliance Sudan Berhad from 2020 until now, where I am focusing on human resource department, outlet operation, and also sales department in the company. Previously, in 2018, 2020, I was the manager of Dhamma Airport Enterprise, a company where holding the pharmacy brand Pharmacy Damai in Kuantan. If you going to Kuantan, entering the exit of Kuantan, so you will be seeing Kampung Padang area and Taman Impian after Felda Bukit Go. So there is the Pharmacy Damai Kuantan was, and now has been converted into one of the branches of Biruni. The brand name is Biruni, so the company is SD Alliance Sudan Berhad. So I was also the former resident pharmacist. I was the practicing pharmacist in SNR Medica. Named Pharmacy Zufa in Kuantan, now has been closed. I was also an alumnus of IIM Pharmacy, doing my foundation in pharmacy in CFS IIM Petaling Jaya. So now in Gambang, back in 2011, 2012, I done my Bachelor of Pharmacy in IIM Kuantan back in 2016, and I had done my Master of Science Pharmacy Practice 2018, and now, inshallah, pursuing my PhD. Not in IIUM, but in maybe some other university lah. Okay, all right. So what actually I did during my study years, when in the IIUM PJ during my foundation, I was actively involved in Mahalah Representative Committee. I was an MRC for Mahalah Abu Bakar in PJ for 2 years as Secretary General. And subjects were similar to all the CFS-IIM students in pharmacy stream. Subject taken was the same with no English classes. So I have to stay for 2 years in IIM because I had to take my Arab class. And during my Bachelor of Pharmacy years, my degree years, I was actively involved in IIUM Pharmacy Student Association, known as IFA. So the Association for Pharmacy Students called IFA, as an Assistant Secretary in 2013 and as the President of IFA in 2015. So during my Master of Science, during my Master's degree, I choose to do full-time research mode. Full-time research mode as a master students is the module combining of PRP and master. So PRP is provisionally registered pharmacist, where you have to do your houseman for 1 year. But back then the module being given by the government, that allowed by the government, is a combination of PRP and also master, in addition to PRP in hospital line and also the pharmacy line and industrial line. So PRP with I done my PRP with hospital module. So this hospital module you need to rotate about 7 to 8 departments. Normally for PRP in hospital, so they will need to complete their PRP module for 1 year. But with this module, PRP plus master, you need to complete it within 3 months only. So I did my PRP with hospital module at Hospital Ampuan Afzan Kuantan. So I also won the first runner-up for 3-minute thesis competition where I need to present my thesis briefly in 3 minutes only. So the title is as mentioned. So briefly about what I done in my thesis is about the drug abuse in Malaysia, where I interviewed hundreds of drug addicts in Kuantan and see and evaluate and analyze what are the treatment they have been taking and how effective it is. So if you interested to know about, then you can search in IIM library or just contact me later on. So we're back to business. So about the pharmacy course. So is pharmacy course actually the best choice? Is it? Are you being forced to take the pharmacy course, or it is your choice that you make in life? So it depends on you, but I will guide you through. Is you still want to proceed with the pharmacy, or you want to know more about what is the pharmacy course is all about? So we'll be talking about prerequisites. So the prerequisite that I searched for this past month, so you need to at least get a 3.0 CGPA, which I believe that most of you got more than 3.5 or even 4.0 of CGPA. So this is the basic requirement that you need to pass with 3.0 CGPA, and also get a B at this for your biology. Okay. So if you pass that and you pass the interview, then you can enter the Kuliah of Pharmacy later on. What about the scholarship? So scholarship that depends on background. Maybe you go for Pa and Ma, and like I myself. And of course, the competition is quite tough now. So you need to work hard for that. You need to work hard on that if you were to take a scholarship or were to apply for scholarship. Okay, a little bit of the subjects that you'll be taking. So I'll guide you through. So in as Bachelor of Pharmacy in IIM, so the course is for 4 years. So the first year, basically, you will be studying more on the basic things, all the basic things like the basic anatomy. If you can see this, basic anatomy, how what the structures of your body, what the structures of your cells. So that is the basic things you need to learn. And also you need to learn about the fundamentals of physiology. The physiology is how your body works, how you breathe, how the blood goes stream into your veins and all. And also the basic things about biochemistry also, you need to learn how the chemistry, the chemical that are inside your body works, how the oxygen is processed. And I believe you learn the basic things or the very fundamental things in foundation, but in degree, a bit more complex, a lot more complex, something like that. Okay. And you also be studying the fundamentals of pharmacy practice, how the practice of pharmacy in Malaysia, be it in hospital, community, industry, marine, something like that. Okay. And also you will be learning about the organic chemistry. So these are the, I would say, a bit of heads up. This is one of the most toughest subject in degree of pharmacy in IIUM. So all the chemistry subject are very hard lah. Okay. And if you can see is the which one? This is the gray one, gray ke hijau, gray ke green. Okay, so these are the university required courses in addition to what the basic courses that you need to take. So all the tilawah, the Islamic worldview, usrah leadership. So that is an Islamic and it is a university required courses that you need to take. That is only for semester 1 year 1, and semester 2 you continue to learn more on the basics, the pharmacology. Pharmacology is how the drug works in your body. You will be learning the microbes in addition to what you have learned in foundation. And also again chemistry, you see here chemistry is quite tough lah. So you need to prepare yourself during the first year. You will be facing the chemistry subjects. And of course, in pharmacy subject, you will be seeing more on analysis things. Analysis means when you're taking things into lab, you need to analyze your subjects, you need to process or your experiments, you need to analyze and also you'll be seeing more on the lab-based and clinical-based subjects during the pharmacy degree pharmacy life. Pharmaceutics is similar to the analysis part, and also this gray and green part area is the university required courses, the EAW, English academic writing, family management and all. Okay, if you survive the year 1, you will move to year 2. Okay, so during the year 2, pharmacology of peripheral nervous system, where you will be learning on the nerves that you have, nerves on the fingers and all. And pathology, so pathology is the disease, how the disease appear, what are the symptoms, how to treat. So that is the general pathology. Anti-infective agents is how you will be learning about your antibiotics, antiviral, antifungal medication and all. And pharmaceutics, so pharmaceutics is a disperse system, how if you would like to disperse the medication into your body, so what are the technology that we will be using to encapsulate or to carry the medication into the body. And again, analysis, you see here, analysis, you be analyzing some labs and all. And community pharmacy practice, which is my line currently, community pharmacy practice. We learn about how to practice in community, what are things that you need to know, basic things before you enter the community line. And of course, the university required subject, you need to learn Bahasa Melayu. So this is, don't laugh that Bahasa Melayu is one of the toughest subject because, okay, I will share my experience during my batch. I would say Bahasa Melayu, 70%, no, 80% got B. Where people, where most of my batchmate thinks that they will get A or A minus, the least, but no, they get B, and some get C for that. So don't take for granted for Bahasa Melayu is I would say not as easy as it seems. Okay, so you'll be learning on Arabic also, Bahasa Melayu Kerjaya, Tilawah and all. Okay. In your degree life, you will be facing also some elective courses. So elective courses is the courses that you will take electively. So you can choose to take, or you may have the freedom to not choose that. So from this, okay, we have nuclear pharmacy and cosmeceutical. So we will not making any bombs or atoms from nuclear. No, we'll be making chemotherapy drugs that emits radiation and all. So that's what nuclear pharmacy is all about. So it's not we are making bombs and all. And also cosmetic and cosmeceutical. So if you regulars to Watson or Guardians, you see cosmetics. So yeah, we will be learning on that. So what are the ingredients, how to use your cosmetic effectively. So because when you are in the line, you will be consulting people on how to use cosmetic effectively, something like that. So for the elective courses, you only need to register only one for this because some of the classes in these elective courses overlap. So you need to only take one. During second semester, there'll be much harder subjects where you will be facing this body system. So body system is something, okay, before this, we learn about the basic things or the general things. What are the medicine? What are the packaging and all? But when the medication enter your body, so you need to learn how this medication um, affects your body system individually. Okay, you will see this cardiovascular and hematology, respiratory and urinary system, and you will be seeing pharmacoepidemiology. Pharmacoepidemiology is important for your research purpose later on if you will be taking your FYP or research later on. So you will be learning on pharmacoepidemiology. And fret not that you need to learn also economics. So brief ke? I think quite extensive, I would say, this economics thing that you need to learn about. And also pharmaceutics also, okay, pharmaceutics is more on physics. I'm not that fond of physics much, but yeah, you will be seeing pharmaceutics and physics also later on. Serial process and products. So this, you will be making your chemotherapy drugs. So you need to learn these processes. Ethics, bahasa Melayu again, yeah, second time you will be learning bahasa Melayu. And the elective courses, okay, you will be seeing elective courses here. There are nutraceutical, halal pharmaceutical, and computer aided. Nutraceutical is your supplements, your will be dairy products that used for patient who will be taking dairy products, learning on halal pharmaceutical, and also drug design. So how we'll be design our drugs using computer. So something like that. Okay, year 3. Okay, year 3, you I would say if you go to kuliah later on, you'll be listening to that. Yeah, year 3 is the most toughest year of all. Yeah, and it is, and it was for me. It's the toughest year for me and my batchmates also, and also for the rest, juniors and seniors, because you'll be seeing subjects that are quite tough and quite packed, the schedule. So you will be learning on anti-cancer chemotherapy, all the chemotherapy drugs. Again, body system, you learn about musculoskeletal and sensory organs, GIT, hepatobiliary, endocrine and reproductive system. So these are the body systems on more on clinical side. So these are the clinical side where you will be go for attachment also during this year, during this semester. Alongside with the theory classes, you will be also go for attachment in hospital in Kuantan to go for direct clinical with patient and discussion with the real hospital pharmacists on your cases. Pharmacognosy is the I would say the learning of herbal medicine, where you will be saying all those tongkat ali, misai kucing and all for your medication. That's quite tough actually. Okay, and you will be learning biotechnology and pharmaceutical also. And USRA, USRA for additional. And elective courses for this semester is advanced drug delivery system. So the advanced drug delivery system means how you will be delivering your drugs, the medication into your body using advanced technology. So now we'll be seeing capsule, we'll be seeing tablets, but what are the advanced technology that make the capsule or the tablet absorb faster, more efficient, and not that painful to swallow, something like that. Okay, and also renal pharmacy. Okay, renal pharmacy is one of my favorite subject because it is fun. It is fun. Renal pharmacy, because you will be going to dialysis center, you will be consulting or clocking cases for patient with dialysis. You will be learning on what are the drugs that can cause your apa kita panggil the renal problems and all. Okay. So you will be seeing more on management things for this semester. You will be seeing pharmacy management and entrepreneurship. And you will be learning also basic and clinical pharmacokinetics. So pharmacokinetics is how your drug, when enter the body, how it's being absorbed, how it's being metabolized, how it's being excreted from the body. So all that processes through lines of layers of cells that you will be learning on. So in pharmacokinetics, you will be seeing more on calculation. Yes, you need to calculate more on that. So yeah, tough lah. Okay, you'll be learning on ethics and law. So ethics and law, okay. We will be part-time lawyer for this semester. You'll be a solicitor for a while, where you will be learning all the law and the ethics, what are the acts and regulation of the Malaysia law about pharmacy. So you will be part-time lawyer lah. Okay, you'll bring also hospital pharmacy practice. Again, body system, central nervous system regarding your brain, and also pharmaceutical quality control. So this in industry, where you will be learning quality control in factories of medication being made. Elective courses also, okay, drug abuse, we will be saying here, drug abuse. So drug abuse is my favorite. I will say my favorite also because I did my master in drug abuse. So of course, my favorite subject is drug abuse. So you'll be saying more, you'll be seeing more drug addicts. You'll be seeing more all the heroin, ganja, and all in these courses. Yeah, it's fun. It's fun. And also pharmaceutical quality management. Okay lah, these courses. Okay, so in year 3, you'll be having your short semester. So year 1, year 2, you have a long semester. Every semester is 4 months. But in year 3, you will be having a short semester for 2 months. 1 month and 2 weeks. 2 months, itulah. Something like that. So semester 3, you will be choosing either one. Either community posting, you go to community pharmacy, attached for about 6 weeks, and learn more on how to be a community pharmacist, hands-on, direct attached with the pharmacy, or you can apply with Biruni later on with me. Either you can go to hospital pharmacy attachment. You will be applying for hospital practices. All right. And year 4, okay, the scale of pain, the pain score is now reducing from year 3 to year 4. So year 4, the pain is like, yeah, you are senior, kan? Okay, so now, okay, in year 4, you will be facing FYP, final year project, not for you page. Final year project. Mind that you will be facing 6 credit hour here for final year project. So it's very big one. So you need to focus on. So you need to present your research and your project in front of professors and all. So it's not the same as English and for academic writing research, no, it's more on detail one. So you need to collect data, you need to go out, you need to do surveys and all. Okay. Of course, there'll be Islamic input in pharmacy. Of course, we as an IIUM student and alumnus, so you will being input with all the Islamic things in related to pharmacy. Okay, elective courses. Elective courses in year 4, they are quite a few. You have clinical toxicology. So toxicology is about where you learn the poisons. You will be learning on the where the poison from snakes, from bees, from bugs, from spiders, tarantula, and all. So you will be learning here in toxicology. Of course, additional to e-commerce, herbal science, public health pharmacy. So that's very straightforward one. And during 4th year of semester 2, you'll be facing 3 attachment, where the every training is about 6 weeks, I think. So you need to go all three in rotation, of course. You need to go for industrial training. So I believe in kuliah there is a ICOP factory. So you can go attach for there, go for training there. Pharmacotherapeutics attachment, you go to hospitals, and community pharmacy posting in community pharmacy lah. Okay. So the total credit hour you need to face is 135. Actually, it's been reduced actually. 135 only credit hour. Actually, it's been reduced. During my time, it's 155, I think. So it has been reduced for about 20 credit hour. So it's like one semester less than that. Okay. So we have been talking about prerequisite, you know, about what are the scholarship. We have talked about the subjects in quite brief detail on that. And what about your career pathway later on? So after you learn for 4 years, so you might be wondering what your career will be, what you will be doing in your office later on. So your career later on, so after you've done your degree, so what's next? So your education pathway is from your SPM or either your A-level or E-level. So you will be seeing foundation or pre-university, where this is your stage now, 1 to 2 years. After you done your foundation, you will be go for pharmacy degree for 4 years. If not extended, it's 4 years lah. Extended can be in case of you fail any subject or you need to repeat any subject, then you will extend. But that is a rare case, I would say, because it's not that tough to get a C or D, but it's tough to fail, something like that, I would say. After you're done your pharmacy degree, you will be going for PRP. So this is your 1 year pharmacist training. So you need to do for PRP. It's not that compulsory that you do your PRP in hospital. You can do it in your community, you can do it in your industrial, you can do in academic line like me in pursuing your master's or PhD. It's not that compulsory, but you need compulsory to do the training. The what line is up to you. And of course, this compulsory service is only applicable for government and also those who are bound to scholarship agreement or contract. So you need to, for now, after you've done your pharmacist training or PRP, then you are free to go to anywhere or any line that you would like to take. So that is your education pathway. So what are the fields that you can embark into in the pharmacy? You have academic pharmacy, where after your degree, you can pursue your master or PhD, then you can become a lecturer. You can become your assistant professor, doing more on research, attending to students, having your way up as in the research line. Okay, that is academic pharmacy. You have also community pharmacy, where after your PRP, you can join the community setting, like what I did in community setting. You practice, you help people in the community, serve the best for the community, and also doing some businesses if you are fond into businesses. And hospital pharmacy is not limited to government only, but we'll be also have private hospital. So you'll be seeing all the 7 or 6 or 7 departments of hospital, of a pharmacy department in hospital. Like you have inpatient department, outpatient department, and all. Okay, and also you have industrial pharmacy. So this industrial pharmacy, like ICOP, you will be do some manufacturing, quality control, labs, and all. So you will be seeing all this career that are not limited to only one, like doctors. Okay, if we are talking about doctors or medical line, You'll be focusing on hospital, either the government or private, or you'll be doing some general practice in clinics. But as a pharmacist, you can go to industry, academic, but not limited to. We also have regulatory pharmacies where you can work with NPRA or Jabatan Kesihatan Negeri, where you can be the regulatory pharmacist. So what are the works of the regulatory pharmacist? You will be do some inspection to your pharmacy, community pharmacy, pharmacy and clinics. And also you will be go to the border of Malaysia, where you will be filtering all those things that come into our country, all the dangerous drugs, and also that is the work of regulatory pharmacies. Can also go to military pharmacies where you can join the army or navy or air force. So you'll be part soldier, part pharmacist. Okay. R&D pharmacies, you work in lab. Lab can be in industry or in academic line. Also as Navy pharmacists, like you can go to Navy, Air Force, or the military one. So part 2. So is still everyone with me? Ada tidur ke? Tak ada kan? Okay, good one. Okay, so part 2. So how's the life as a pharmacy student in kuliah? So I would say that it is enjoy lah. I would say enjoy. Okay. Life foundation versus degree is the difference is the time management. So in foundation, you may have a lot of spare time as compared to degree, where your classes 7 o'clock in the evening. So during the first and second year, your class is during the first and second year, your class will be quite cramped, where all the university required courses and all. So you will be facing this classes 8 to 7, 8 to 6. So you akan barai lah. So the time management is very important. In addition, if you have something to do outside job and all. So the difference is the syllabus also. Of course, there are more syllabus in degree. The evaluation method may be different because the evaluation methods in degree may comprise of exams, written exam, oral exam, labs, direct supervision and the real pharmacies in hospital, and real patient. Sometimes lecturers will invite real patient from outside come into your evaluation period later on. And the difference is also zombie students. So zombie is quite famous in kuliah pharmacy, where this term is used for pharmacy student. Why? Because there are a lot to memorize. So you will be seeing that if you are good memorizer or you are hafiz of a Quran, so there will be so much easier for you to memorize all those chemical structures, all the names of medication, all the so they are terms that people will call pharmacy student as zombie, because after you memorize, then you go out as a zombie. So very tiring after memorizing all. Okay, that is comparing life foundation versus degree. How about life on campus? So life on campus depends, because kuliah of pharmacy, IIM Kuantan campus is quite big. I would say quite big. It's quite big. I think bigger than Gombak campus. I think bigger than Gombak campus, but the facilities is not that at par as Gombak campus, because IIM Gombak is the main campus, and maybe lesser as compared to Gambang, I would say, because something need to do more on that. So transportation, there'll be buses for transport from one kuliah to your mahalla and all. And also there are students also who are bringing their own vehicle, motorcycle and also cars. How about internet? Okay, internet. Internet, I would say that you should have your own internet. Don't rely on the university internet because it's very, 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 very weak. Okay. How about extracurricular? You are an active person. You need to do more. You need to do something outside the classroom. So we have extracurricular. You have all your all the persatuan, all the games. You can play sports there, like normal campus. Be active in your degree life later on. Okay, how about practicals and internship? So practicals and internship, there are two approaches. One is hands-on, where you need to do your lab, you need to clerk your case, the real patient, and discussing with the real pharmacies. So it's not things that you should take for granted. And also the zombie approach, where you can scram all the knowledge that you have and try to memorize and put it in a good way in your practices later on. Okay. What are kind of internship that we will be having? Attachment and posting. So what difference between attachment and posting? Attachment is like during the third year, you'll be having body system subject. So this attachment is like 2 to 3 days attachment there. So you'll be clerking cases for that specific subject only. But posting will be on a longer time. So like a community posting, hospital posting, where you will be seeing all sort of cases for 2 to 3 weeks or even to 6 weeks and all. And also PRP-ship, like I mentioned, PRP-ship is a 1 year compulsory posting that you need to do in order to get your license. In order to get your license. Okay. On top of that PRP-ship, you will be having this exam called forensic exam. Remember that I mentioned that you will be part-time lawyer during the third year, where you will be learning on ethics and law. That forensic exam is about the law. So about the law. So that law you need to learn and memorize. It is an open book concept where you will be given 3 hours of exam time and books at your side. You can open that book and search for answers. But in my experience and others' experience, you will not actually touch the book also because you don't have any much time, because there are 100 questions. You need to answer within 3 hours only, and it's all about memorizing. So you need to memorize. Again, you have to be zombie for that. It's a minus marking concept. Minus marking concept is you get right, you get 1 point. You answer something wrong, you'll be minus that right. You'll be minus 1 point. So better not to answer than getting wrong. Something like that. So that is minus marking concept. And and all the exams in the degree of pharmacy is the minus marking concept. Answer when you truly think that it is correct, then you will get 1 mark. If you think that you are right, but actually you got wrong, you will be deduct 1 mark. Not 0, deduct 1 mark. So life is like that lah. Because it's similar to practices. If you give wrong medication, there's no marks there. There's a life there. So think wisely before you are giving your medication or answers and all lah. So because life may be at stake if wrong decision being made by healthcare professionals. How about the study tools? So you can normally you will be having notes. So notes during my time, all these gadgets is not that widely used, but we are using notes, printed notes. Lecturers will be giving you notes, and it's up to the batch or It's up to you to print or to only learn in your electronic devices, iPad, notebook and all lah. How about part-time job? So you can have part-time job, either you, but you need to manage your time properly. You can either go for online or offline job. There are students normally during fourth year, I think, third or fourth year, there are some students who are taking an part-time job offline lah. Be go for groceries and do some part-time job there and all lah. Okay. So how about any fails or quitting? Quit, obviously not, because I've managed to survive this year of pharmacy. But how about fails? Any failure during my year? Have I failed in any subject? Yes, it's medicinal chemistry. Like I mentioned, the chemistry subject is quite tough in pharmacy degree, but there are some who pass. I fail, but some are pass. Some have passed. The statistic back then was during this fundamental of medicinal chemistry subject. I would say not much. About 60% of my class fail, I think. Yeah, and the lecturer did repeat exam for that subject, for that quiz, repeat exam. Again, there are some who fail for the second time. About 30%, I think, 30% who fail for the second time. So it's tough for that chemistry. But have I feel demotivated back then? Yes, of course. It's your degree. You have taken your journey so long from SPM to your degree, but you fail certain subjects that will drag down your marks and your pointers. Feel demotivated back then? Yes, I did. But how do I keep myself motivated? I try to distract myself from only focusing on the failure. I try to get involved in extracurricular activities, not that feeling focusing on the failure and feel all the depression thing. No, go outside, release your stress first, be active in your extracurricular activities, and of course you have to manage your time properly, especially during exam. During my time, you will be seeing that you have only 2 weeks of exam. 2 weeks, 1 week, I think, 1 week plus of exam time, with about 6 to 7 papers, I think, 6 to 7 papers. And the exam, it's like a similar, like a mini SPM. So SPM, you have 9 to 10 subjects all crammed within 2 weeks, can? Similar like that. For every semester. Something like that. So, and then it's much tougher. So you have to manage your time properly during exam. So if you get involved in your, you need to manage your time in kuliah, where you get all the tough subject. You have also to manage your time during extracurricular activities. You go for riada. And also for me, I have my enjoy time. So enjoy time may different from one person to another. Some enjoy their time or some healing process. Healing. Go to buy strolling by the beach, and some go to library, some go to karaoke, movie and all, and some go to masjid, mashallah. So you have to manage your time properly. Use from time to time, you need to get your enjoy time, but it's only a distraction from depressing things in kuliah. Okay, you have to find your support system. You need to have your support system. It can be your family, can be your friends, and can be your religion. So the religion that is the most important support system that you need to have is your relation with Allah Subhanahu wa Ta'ala. Okay. Don't be so introvert and be alone at all time. No, don't. Find friends, find your family, find your God. Okay. So now I am motivated now. So what's next? I have find my support system. I have go to enjoy time, my and all. So now what's next? So I need to you need to plan your future. You must know what you want. If you think, okay, I believe that during this foundation, you may not know what you will be want, because you have not experienced yet what the subject will be about. And but throughout the process, think about what you want to do after your degree life later on. See if you can go for clinical, go. If you have your fond to community basis, serve the community, go. If you are not a people person, go to industry, talk to machines, something like that. Okay. And of course, look for opportunities out there. It's not necessarily that you only to look for, oh, okay, I want to do clinical, I have only to go to government hospital. No, you can have private hospital, clinics, and all. So look for opportunities out there. You need to balance out, make pros and cons. So if I go to this line, what is good and what are the cons? What about the salary? What about the work-life balance? Okay, what about the knowledge that I'll be applying? So something like that. So ask also for opinions from friends, from your support system back then, friends, family, and also your lecturers, because your lecturers have a lot of I would say information from their students, be your lecturer, be your seniors or your juniors later on. So your lecturers is one of the good sources that you can ask for opinion. And of course, you need to know about the current politics in Ministry of Health system, because the system can fluctuate from time to time. It can be yes, can be no, can be contract, can be permanent. So keep up to date with that. Okay. Of course, do part-time jobs, gather some experience. Of course, I'm not saying that you need, if you are good or you fond of clinical, you go part-time in hospital. No, this is applicable for like community pharmacy. You can do some part-time jobs there, like do some locum and all, gather some experience, know some medication, know how to handle patient. Later on, it can be very useful when you are when you will be dealing with patients later on. Okay, so do some part-time jobs, gather some experience. So later on, when you go to interview in your after degree life, so at least you have some to show. Okay, in your resume, I have do this, I have do this, I have do this. So a bit advice from you: prepare physically, of course, mentally, of course, and spiritually. That's the most important. You need to believe in yourself. You need to believe in what you will be doing now, and appreciate life, yourself and others. So there are some people who are thinking on the negative side, because like I said, if they fail, they feel depression, they don't know what to do with their life. No, appreciate your life. You have your surrounding, you have your support system and all. So that's a little bit advice for you. So enjoy what you do. Even you are in not enjoyable moment like studying and all, but just enjoy the days and the time. Okay. So a bit a meme for pharmacy. I read it for you. How long does it take to stick a label on a box? Then the pharmacist said, only a few seconds to stick a label on a box, but it's the making sure the medicine doesn't kill you thing that takes a bit longer. Yeah. If you go to outpatient pharmacy or even to community pharmacy, you'll be saying, oh, you're preparing the medication for quite too long. Yeah, it looks like easy because you are sticking a label on medication, but the harder things is to make sure the dose is correct, the patient is correct, the diagnosis is correct. Then we can deliver the medication to you. You can give prescription, follow the prescription, but sometimes prescription may be wrong. And that is very common in hospital setting. When outpatient pharmacy receive the medication from doctors, sometimes we have to call and follow up with the doctors, counter check with doctors. Doctors, are you giving this patient this dosage? Because it's wrong. It's underdose or it's overdose. or the medication is totally wrong. So there are things that are the things that we as pharmacists or future pharmacists will be facing. We are the line before the before the patient received medication. Okay. All right. Thank you. You may contact me through these contacts, these addresses, these emails, and also on TikTok. But my TikTok is not about pharmacy. My TikTok is about human resource, what I did in my company. Okay. All right. That's all from me. Is there any question from the floor?
Thank you very much, Brother Nazrin Shafiq, for the informative talk and sharing session with us, the juniors. Now we have come to the Q&A session. Dear brothers and sisters, if you have any question to ask, you may write your question in the chat box. Brother Nazrin, so there's one question. Um, as you see, there is a low chances to fail, but if the students continues to fail, so is there any option or is there any consequence after that? Thank you.
Okay, all right, thank you. Why focus on the failure? Don't focus on the failure. You may have a chance to get to fail, but it's a low chance. Low chance. Because I would say I would say out of 100, no, out of many subjects that we have, you may fail 1 to 2 subjects only. But if you fail, you need to repeat. Repeat in the next semester. Let's say you fail a medicinal chemistry subject in year 1, second semester. So that medicinal chemistry subject, you need to repeat that subject in the following semester. And you need to repeat until you pass the paper. It's not that it's not that hard pun to pass. You need to only get 50 marks, then you pass. Okay lah. It's not that hard pun.
So next question, what is your opinion about no, what is your opinion about the work-life balance? Can you elaborate more?
Work-life balance. Okay. Okay. I'm not going into all the viral things or any FYP things about work-life balance in the internet, but okay, work-life balance. It depends how you define the balance that you see. Okay, some people view work-life balance as you work harder, you play harder. I mean, yeah lah, you work harder, you play harder. You work 8 to 6 or 8 to 5, then after that you focus on your family. So that is work-life balance. There are some people that can work 24 hours, not 24 hours lah. Most of their days from Monday to Friday and weekend, they have their life. some people also have their life in their work. So they very enjoy their work, and they regard their work as their life. So depends on how you see the balance in your work and your life. Of course, later on you will be having your family, you have your kids, your wife or your husband, and now even you don't have your spouses yet, you still have your parents. You need to also focus on them, but depends on your how you define your balances. You need to create the border. Okay, this is work, this is life. I have to have my life also. I have to focus also on my work, because the work pays the life. Can so depends on you. I'm not putting certain standard that you need to do in your life, but you need to think how much is your life, how much is your work, then you will get a balance. Okay.
So next, I'm inspired with your life now. How you manage your time now?
Now, penat. Now, okay. During our startup in 2020, I have no life. I would say I have no life. I have no life during the startup, because we have just start up the company, and so the new brand, focusing on the sales and all. So I have to work from 9 to 5. Then after Isha, I will continue, open my laptop and do some things, and sleep at 12. Then the next morning after subuh, I'll continue, open my laptop for 1 hour, do some works, breakfast, then go to work. That is my life back then. But now I have my staff. So staff taking a bit of my work, then I have my life lah. Okay lah. I can still go for holidays. I still can go for movies. Cerita John Wick 4, can. So something like that. So life is good now. Alhamdulillah.
Okay, so for the next question, is it hard for fresh graduate pharmacists to get a job nowadays?
Okay, thank you, Sister MC. Is it hard for fresh graduate to secure a job nowadays? Okay, it depends on on which path you want to go. If nowadays in securing your job, you need to see a few things lah. First is what you want to do. Second is what your skill are, and what are the opportunities. If you want to do, let's say, I am very fond of clinical setting. I can do some patient clinical things lah, clerking patient, go what wrong with doctors and all. But the skills that you have not at par as a hospital pharmacist. You know what I mean? You can have the passion, you can have your what you like, but you need to also compare with the skills. Are you good enough as a hospital pharmacist? Are you good enough with the memorizing all this medication? Are you good enough in your calculation if you want to go for clinical? Are you good enough in your entertaining doctors and also patients? So that are skills. Thirdly, sometimes you have your passion. I want to go for clinical. I want to go for hospital hospital life. I have some skills. I'm the top students of my batch. I have all A's without failure, or 4.0 CGPA for my degree. But there are no opportunities. Susah juga. Okay, can. So if there's no opportunity, that depend on you, on the risky also. Risky also. At times you need afford, and nowadays you need to be more flexible. I have one my batchmate. He's the top of our class. He got I think first class honor ke 3.7 something. Dia punya the CGPA is the top of the class. He's very good. And during the PRP in hospital, he's very good with the specialist looking for him, want to talk with him, want to go for discussion with him, refer to him, even though he is only a PRP, not a full pharmacist yet. He's only PRP, but the specialist looking for him. But he's still he was a contract pharmacist, and the contract is terminated because there are no vacancy, in that hospital and nearby hospital. So the opportunities is also plays a big role also in the decision making of your career pathway later on your job securing. So maybe now he's in my line also, community pharmacist, serving community, but that also a job. It's not that community pharmacy is the second line or third line after hospital. It's not that one is more superior than the other, but you need to look at these three factors. What are the opportunities? What are your skills and the passion? Of course, you need to do for your passion. If you go for community pharmacy, then go. I would say in general, hospital pharmacy, lower vacancy rate now. Industrial pharmacy, high vacancy, but the opportunity to get into that is quite tough, because the seats or the vacancy that they open is only for few seats. Like hospital may open to maybe 10 positions per hospital, but in industry they may open for 3 position in hospital. In industry, in factory, as QC, as manufacturer, head of manufacturing. So it is not that much of seats or vacancy that they open in industry, but in community, but they are lambakan kan. There are many community pharmacy that are open nowadays, so you can search for that. So yeah, you can make your choice based on that. And many people that don't see more on academic line because they need to further their study masters. So that is a much few option lah people would take, and I would say like that. Okay.
Okay, so for the next question, does the elective courses we take affect our career path in the future?
Oh yeah, betul. That's the elective courses that we have chosen affect our career future. Affect, I would say, if you have chosen, if you choose your, let's say, if you want to be elective courses. The elective courses is to prepare you for what may be coming in the future. But sometimes it may affect in a way that if you're firm with your decision, let's say, to be in a community setting. So the apa kita panggil, the elective courses like e-commerce, like community pharmacy attachment, that you need to choose either one as compared to hospital, this play a big role because you learn in depth about the subjects that you will be using in your future career, future path. But if you are still thinking about what to do in life, what to do after degree, so you may take a step back and look what you have learned during your elective courses and all. So what can help you to be in the industry, to be in the career much better. Let's say you take research project. You take research project. You do some FYP, all the academic things. Then that will help you to be a good lecturer because you have the basics on your for your research. Maybe you want to do toxicologies. You take clinical toxicology. So when you go to hospital in inpatient department, so that inpatient department need that knowledge that you may secure yourself in the hospital settings, that because the knowledge of toxicology that you have, something like that.
Okay. So for the last question, inshallah, one student is in dilemma whether to take pharmacy or medic. Can you share why you taking pharmacy?
Okay. Wah, dilemma. This is a common dilemma for all, I think. To be honest, before my foundation time, during my UPU, I take the first choice is medical medicine. Second is pharmacy. Third is dentistry. But UPU, I get pharmacy, my second choice. And I have not regretted any of my decision back then because I like both. I choose this healthcare line because I want to work with people to get people be better in their health. So I can do that in if I do medicine, I do pharmacy. Pharmacy, though it's not we don't have title like doctors and all, but yeah, I enjoy pharmacy because one, to be honest, because the opportunity of job for pharmacy is much more as compared to medic nowadays. Because like I said, medical students, after they graduate, they need to do hospital housemanship. Hospital only. So by group, they need to go to hospital, be it contract or permanent. So they need to go to hospital to finish up their 2 years housemanship and 3 years of medical officer, MO-ship. So that is 5 years compulsory services. But for pharmacy, if you are not good, it's not good. You are not fond into clinical, then you have option. You have industry, you have community and all. So that's our option. I see pharmacy has more options of career opportunity out there. That's why I'm taking pharmacy. And I have not regretted any of my decision until now, alhamdulillah.
So alhamdulillah, thank you Brother Nazrin Shafiq for all the answer. Brothers and sisters, please be reminded to sign your attendance via the I attend link and fill in evaluation form, which will be shared in the chat box of YouTube. Alhamdulillah, we have reached the end of our event. On behalf of the organizing committee, I would like to take the opportunity to express our gratitude and thanks to our honorable speaker, head of department, coordinator academic coaching and enhancement unit, academic advisor and lecturers for gracing this event. I also would like to apologize for any shortcoming throughout the event. Before we end, please be reminded again to fill in the evaluation form. Thank you everyone. Let's end with Tasbih Kafarah and Surah Al-As. Assalamualaikum warahmatullahi wabarakatuh. Brother Nazrin, inshallah, after this we have a photography session.
Okay, sure. Normally after event, kalau offline akan ada lunch kan, tapi tak mungkin lah hari ni. Kalau offline event.